Now, let's speak to our immunologist with the University of Ghana, Research Fellow, West African Center for Cell Biology of Infectious Pathogens. Dr. Yaw Bediako is right there. Good morning to you. Doc, thank you so much for joining us here on the AM show.
Good morning. Thank you for having me.
Okay, great. Now, I want to ask the issue of, these days people are reporting of malaria. In fact, some test positive for malaria and then typhoid, and then they get treatment. They don't get better. Eventually, if they are lucky enough in some cases to get the COVID-19 tests, then they test positive for COVID-19 and they start getting the treatment. But what has changed? What is happening?
Well, it appears that we have much more transmission of COVID at the moment. The numbers are, as everybody can tell, the numbers are rising significantly. And there's a lot of overlap between the symptoms of malaria and the symptoms of COVID, fever, headache, joint ache. Those are all things that are characteristic of febrile illnesses. Now, COVID and malaria obviously are caused by two very different pathogens, but on the surface, especially in the beginning, some of the symptoms would overlap. And in Ghana, up until COVID, if you ever had fever, the assumption straight away was perhaps you had malaria, and that was sort of the first thing that doctors would look for. The good thing is, it's very easy to test for malaria in Ghana. We have a rapid diagnostic test that I'm sure we've all done at the clinic. You can even do it at the pharmacy. And so it should be quite easy to eliminate malaria or to confirm malaria in cases. So, of course, it is possible to be infected by both in unfortunate cases where you probably have malaria as well as COVID. But I think that the normal practice is to eliminate something like malaria, and then the next step should be then to do a COVID test. The hope is that everybody who requires a COVID test can have access to one. Of course, currently the practice in Ghana is to, at least public institutions are only testing people who are symptomatic. So if you don't have symptoms of COVID, or at least symptoms that are, associated with COVID, then it's much more difficult to get tested. And I think many of us have been talking about the asymptomatic burden.
The other person, is he on?
Contributing to transmission. Sorry?
Virologist with the University of Ghana Medical Center, Professor Kwame Nasego, the school, I beg your pardon, also join us in the course of this conversation when he's on. Okay, he's on, so I can have him share. Okay, when he's ready, he will join us. So, Dr. Yaw Bediako, in that sense, if I test positive for malaria, should I insist on a COVID-19 test at the same time?
Not necessarily. I wouldn't say so. If you test positive for malaria, then that would be what you should be treated for. But of course, there are certain symptoms that are unique to COVID. So malaria doesn't really cause upper respiratory tract symptoms. So cough, sniveling, sore throat, those are not symptoms of malaria. So if you went in and you have sort of these flu-like symptoms, and you happen to test for malaria and you are positive for malaria, at that point, I would say, yes, you should probably request that you get a test for COVID because you have certain symptoms that are not associated with malaria. But if all you have is a headache, fever, joint ache, and you do a test and it comes positive for malaria, then I think the first thing would be to take the malaria treatment and see what happens. Ideally, like I said, in this day and age, it would be great if you could get a COVID test as well. That's what I would probably recommend. The challenge is the Ghana Health Service recommendations currently for people to get public access to testing. You have to, a doctor has to have reason to believe that you might have COVID. Of course, if you can afford it, I would say go to a private clinic and get yourself a COVID test just to be on the safe side. But publicly, if you are waiting for the Ghana government to pay for it, you're probably going to have to justify by having some upper respiratory tract symptoms in addition, given that they would probably say that the fever symptoms are more likely due to the malaria that you've been diagnosed with.
This may sound very basic because we've gone past, but can you just remind us again of the symptoms of COVID-19, just in case?
All right. Well, there are a variety of symptoms. Actually, over time, COVID has acquired seemingly more symptoms. So initially, it was headache, cough, sore throat. So things that you'd think of as flu-like, fever, which is running a temperature some joint pain, so feeling achy in your joints. Diarrhea has also been associated with people with COVID. So some people have gastrointestinal symptoms, so running diarrhea, and general feeling of malaise, as doctors would say, sort of having just feeling quite weak and tired. So I think those are the common symptoms that people have reported. But I would say at this time, given how much COVID is around, anyone who feels unwell and can't quite figure why they are unwell. Obviously, if you have trouble breathing, those are one of the most severe symptoms of COVID. But if you're feeling extremely unwell, under the weather, you're not shaking it off. My recommendation would be, if you can, go and get a COVID test. You may have to pay for it if it's deemed that your symptoms don't quite align. But if you can afford it, there are places now you can get a COVID test for 300 cedis or so. I would say get the test, not just for your peace of mind, but also for the safety of those around you, because you may have relatively mild disease, but someone around you, a close family member, an elderly uncle or a parent, who you potentially could infect, might not have a similarly mild infection. So it's really our responsibility to those around us, if we are feeling unwell, to determine whether or not it is COVID. And if it is COVID, to seek appropriate care and certainly to isolate ourselves from anybody else.
I've heard humidity fights flu, and these days the weather is more humid. Is it a good thing with the fight against COVID-19?
Personally, I tend to stay away from these broad statements. Initially, it was the hot temperatures are going to kill COVID. That hasn't worked. Things like humidity, yes, if the air is very dry, it can irritate your airways. So sometimes it's the same as steaming. Steaming is not going to kill COVID-19, but if you had a blocked airway, if you had a little bit of catarrh or flu-like symptoms, it might make you feel a little bit better, because it might help to open up your airways and make it easier for you to breathe. It's not curing the disease. So I think the same thing with humidity. If you have a cold and it's humid, you may not feel quite as uncomfortable as if the air was very, very dry. But that has nothing to do with the pathogen, the virus. It's not doing anything to the virus. The virus is perfectly happy in humidity. It's perfectly happy in some levels of heat. The idea of hot temperatures, yes, if you found the virus on the surface and you heated it up, you would kill the virus eventually. But the virus is living inside of us. So when I walk outside in Accra on a 38 degrees Celsius day, the virus is not really exposed to 38 degrees Celsius, right? The virus is exposed to my body temperature. So to be honest, I think, as the doctor who was on before me said, nothing substitutes for the original protocols, which are social distancing, wearing a mask, washing your hands. And to be honest, the most important of all of those, the only one in those three that actually protects you almost 100% is social distancing. If you're not close to somebody, they cannot infect you. If you're wearing a mask, but they are not wearing a mask, they can infect you. If you wash your hands, unless you're always washing your hands, and of course you might wash your hands, but then you might breathe in something, you could still get infected. So we tend to adhere to the masks and the hand washing relatively well at these so-called, all protocols observed events. Like she said, we don't adhere to the social distancing. And it's difficult. How do you talk to somebody when they're 3 meters away from you? But I think that's where we are. We have to recognize that without social distancing and in the absence of a vaccine in Ghana at the moment, that is really the best shot we have.
There are people who, they get it and they can't remember how they even got it, because people would say, I haven't been going out much and I've always been wearing my mask. Is there a reason? I mean, like, what do specialists like you attribute that to?
This virus is, it's just the nature of the virus. The virus is very, especially the newest variants of the virus, which, we have certainly found at the airport, yet to confirm whether they are in the community, but there are chances that they are. This virus is highly transmissible. It passes in droplets from person to person, and you don't see these droplets. So, yes, you may not have gone out much, but our definition of much, right, is relative. Somebody's definition of not going out much is going out once a week. Someone else's is going out once a month. And also, if you go to a shop, you may not have gone to a party, but you might have gone to a supermarket, and you were, you saw that cabbage that you wanted to get, and there was somebody standing right there, and you were shoulder to shoulder with a person looking on the shelves. Perhaps that person is COVID infected. They may have been wearing a mask, but like we said, the masks are not 100% foolproof. And there may have been some COVID droplets around you in that point, and you breathe them in. That is what is so difficult about this virus, is because even when you follow all the protocols, you are still not 100% protected. But it's the best we have, the best we can do. And so, yes, it's a very challenging problem. There's a reason why 100 million people around the world have been infected so far. 2 million or over 2 million have died. This is unprecedented. We will probably never see anything like this in our lifetimes again. But so it is a challenge that we all are facing. And we have to do the best we can to minimize the risk. No one is talking about eliminating risk. That is impossible. But minimizing risk means being smart about where you go, when you go. Maybe shop at a different time when it's not so crowded. If you can work from home as much as you can, do that. If you see somebody next to you not wearing a mask, I think you have a right to ask them respectfully to put on a mask, especially when you're in shops and places that are supposed to be enforcing these guidelines. But all we can do is try to minimize our exposure and hope for the availability of vaccine locally.
I'll come back and ask you about our young learners who are in school. Yesterday, the Ghana Health Service Director disclosed that only about 3, people have been infected with the reopening of schools. But I would ask you more on that. Let me just bring into the conversation Professor Kwame Nasego, who's a virologist with the University of Ghana Medical School. Good morning to you, sir. If you can hear me, thank you for joining.
Good morning, and how are you doing?
Oh, very well, thank you. I hope you are too.
Yes, I'm fine. Dr. Bediako, good morning.
Good morning, sir.
And then thank you for the hard work you're doing in the sequencing.
Would you want to let us in? You said in the sequencing. Is it the new variant?
No. Basically, he's working hard on looking at the variants that are in the country. You need some special techniques to do that. There are quite a number of people who can do that in the country, and he's one of them. So he's working hard.
Great.
I think that people should know that he's working hard.
Okay, because my first question was going to be about the South African variant and the UK variant. To you, Prof, in terms of what we're learning about that with the recorded cases.
So I prefer to take it this way. I'm sure Dr. Bediako has spoken a lot about the variants. I just joined in. I'm sorry for that.
So not quite on the new variant. So go ahead.
Oh, okay. So basically, viruses change when they are in the population. This is a new virus that is alleged to have come from a different environment into the human population. So as it grows and continues to grow in the population, it will continue to change over time. Some of the changes may not be significant in that it will not affect how it behaves. They will just be quiet changes. They will be there, but yet will not affect the behavior of the virus. But others may affect the behavior of the virus. It either makes it more efficient at growing in the environment, or it can even slow it down. So the changes that will occur can ultimately determine how the virus would behave. Now, the fear is that the South African variant has quite a number of changes. And the fear is that it will not be efficient. The vaccines that are being produced may not be efficient against that variant. But they are still not sure, but the possibility is there. I've been trying hard to think of a simple illustration to help everybody understand. It's a difficult thing. But you see, when you have, let me put it there, if you build building blocks of cubes of sugar, normal sugar cubes, okay, and then you remove one from somewhere inside, you realize that sometimes it caves in and it changes the structure of the kind of structure you've built. Just ordinary cubes of sugar, you put them up and pile them up, and you remove one from inside, somewhere inside, it may not collapse the entire structure, but it may change how the entire structure looks like. So you still see your sugar built up there, but with a slightly different structure. When sometimes the proteins of the virus change because of some of these mutations, it changes how they look like in nature, so that if they have to bind to something, they may not bind efficiently, or they may bind more efficiently because of the changes that have occurred. And that is what it seems that we are seeing. Sometimes I use a simple key and then the lock. You know that we make copies of keys a lot. If you put it in the keyhole doesn't change, but you keep the key changes. So if you make several copies of keys from an experienced blacksmith to an inexperienced one, the ones that you get from an experienced blacksmith or somebody who's using current technology may be more efficient at opening the door. It's the same key that you've given to all of them, but the one that is made by a less experienced blacksmith may be less efficient at opening the door. So the one which is more efficient is able to go and open the door as though it was the original, but the one which is less efficient may not be able to open the door well. You will need to adjust the lock several times just to open it. So the mutations behave like that. Once there's a mutant, it can affect the behavior of the virus. In this case, they say it's making it more efficient at spreading. Dr. Bediako may say I'm wrong or not. I don't know how much work they've done, but I believe that it's been here long ago with us. It's just now that we are seeing the effects of it. It's not something that just came probably even during Christmas. It probably was here even before Christmas. But because it's more efficient at spreading, it's spreading much faster. And because it's more efficient at spreading, it will gradually push out the one which is less efficient at spreading and gradually become the dominant one. The fear is that if the virus continues to change and we don't get a hold on it as soon as possible, we'll still have some more mutants to deal with and more variants to deal with. And that will make the work even more harder. And I think I heard him at the tail end, talking about, you see, the traditional things have to be done. Social distancing, wearing your mask, all these things are not 100% effective. But if you do them well, it reduces your risk to a very low chance of you acquiring the infection.
Okay. Well, Prof, I'll let Dr. Bediako continue from there. And if you can just reposition yourself a bit so I can see the full of you on the Zoom this morning, that will also be great. Dr. Bediako, tell us a bit more about this new variant and whether or not activities of Christmas, the elections also contributed to where we are today.
All right, thank you. No, I think Prof has explained it really well. The virus continues, these viruses mutate all the time. It's not unusual for them to mutate, and they mutate as a way to survive because they are always under pressure from the immune system. And so they evolve away from whatever the immune system is doing. So they're constantly, their nature is to always be changing, which is why we have to move quickly. When you talk about, deploying a vaccine, because over time the virus will naturally move away from what the vaccine can basically recognize. These new variants that have sort of made the news, there's a UK variant, South African variant, and actually now a Brazilian variant. These are variants that are particularly interesting because they appear to be associated with increased transmission. And in the case of the UK variant, there is some talk about it being more pathogenic, causing more severe disease. Now, we call them the UK, South African, Brazilian variant. That is just where they were first identified. So I think Prof is right. We cannot necessarily say that this one started in the UK. That would be a mistake. The UK has done more viral sequencing than any country in the world. So far, they've done 200,000 sequences. So they were more likely to identify a variant than anyone else. But what is called the UK variant anyway, B117 is the sort of the technical name for it, has been identified in a number of countries and has been identified at Kotoka International Airport in a number of passengers. Now, what is most interesting about that, and this speaks to what I think Prof was talking about, is that we found it in people who are not necessarily coming from the UK. I think the Director General of the Ghana Health Service mentioned it in the briefing yesterday, that actually we identified this so-called UK variant from people traveling from within our sub-region, coming from from Nigeria, from Burkina Faso. I think there were some from Tanzania. So even though we call it the UK variant, these people were actually not traveling from the UK, which suggests that this variant is already present in a number of countries around Ghana, and in fact may already be present in the country. We are currently working really hard, sequencing locally collected samples to see if we can find it. With this, sometimes looking for a needle in a haystack. So we have to do a lot of sequencing to identify the variants among a bunch of other variants that may be there. But the reason these variants are particularly concerning is because it appears to have changed how the virus behaves. So there are other variants of the virus that all appear to behave relatively similarly. But with these variants, there's evidence that they are much more transmissible. The UK variant, for instance, is being credited for the surge in cases you've seen in the UK. And the South African variant, similarly for the surge in South Africa. If we indeed have these here, then that might explain some of what we are seeing, because if it is 70% more transmissible than what was around before, it would explain why all of a sudden we're seeing a ballooning in our own cases. Now, whether this is, there's been talk about the election, talk about Christmas. I am not going to split hairs and say whether it was the election or it was Christmas. It is social gatherings of any kind. We saw an increase in funerals. We saw an increase in weddings from November to December when the restrictions were relaxed. We are still seeing funerals and weddings going on. Any events where people are gathered in large numbers, where they may be wearing masks, but they'll pull them down to talk, get on the phone, sip a drink, eat food, whatever it might be. Bars and pubs were open, right? People, they say they're outdoors, so it's not as bad. You are still sitting very, very close to somebody else. All of those situations cause or create opportunities for the virus to spread. And once that spread, occurs, then you're going to see increases in infected people. And unfortunately, now we are seeing increases in sick people. So it's no longer just asymptomatic cases, but we are seeing a significant increase in the number of people requiring intensive care treatment, requiring oxygen, and unfortunately, the number of fatalities. So it is definitely linked to our behavior. I don't think anyone is disputing that. I think it's unhelpful to argue whether it is Yuletide versus election. It is just people being together. Whatever the reason they were standing together, that is how the virus doesn't care if it's an election or it's Christmas. All the virus knows is I can transmit from one person to another. And if you're doing that, then that spread is going to happen.
Prof, yesterday there was the headlines of the hydrogen peroxide, the recommendation for it to augment COVID-19 treatments. I was excited about it in the beginning when we're doing our paper review, but later on, I learned that there is also a danger, and the fact that it was just put out there like that, people rushed to some of the pharmacies to grab it. Talk us through why that may not be an option or the dangers associated with that. And I'm only asking you because it is already out there and people are going to pharmacies to get it.
Actually, let me say this. I use hydrogen peroxide. So I can understand where you're coming from. And I've been part of the group doing the literature search on hydrogen peroxide. Now, the use of hydrogen peroxide is not to say that you cannot be infected, or we should leave every other thing and just use hydrogen peroxide. We're just saying that assuming you have come into contact with large doses of the virus, which may have escaped the basic protection measures you have used or you are using, then you can probably use. Now, let me explain. You know that the dentists have used hydrogen peroxide and other gargling solutions for a very long time. And what happens is that they use it to try to reduce the amount of the virus or any infections that they may come into contact with, because they are opening your mouth and working in your mouth. And so it's not a new practice. They've been doing this. There's a university in Germany, if I'm right, it's Bielefeld or something. You can check, I can check the actual name, where they are now gargling as an official thing, because they realize that a pharmaceutical company and the university have, the dental department of the university have come out with some sort of a formula where people gargle and then they what do you call it? They prevent, the idea is that you prevent people from shedding copious amounts of the virus so that people around you, even if it escapes from your mask, are not likely to get it because the concentrations are low. Now, if you look at the WHO's formula for sanitizer, there's a 3% hydrogen peroxide in it.
Correct.
And that is because it is effective against the virus. So now let's come back to your issue. I thought that I should give this preamble just to establish the issue of gargling, among others. Now, you see, if we have cells in our mouth, normally in a viral infection, you can have what you call primary replication in the natural route of infection, if it's going on. You can have a primary replication at the site of entry, and then it can descend. When the number of particles of virus increase because of the growth, it can descend into your lower parts, in this case for SARS-CoV-2. So we are saying that if in case that the virus escapes your mask and manages to settle in your mouth or your nasal cavity, what is going to likely happen is that it will settle there, grow a bit, and then descend further, depending on the host. There are several factors actually that make you sick. It depends on how much you've come into contact with the virus, how much the virus you've come into contact with. It depends on even the type of strain you've come into contact with. It depends on you, the individual, how your body is also going to respond to it. So there are several factors. So the assumption is that if you gargle the hydrogen peroxide and you have any of the viruses which have attached to the surfaces of the epithelial cells, viruses will normally attach for a while and then enter the cells, replicate, come out again, and spread to other cells and replicate.
Okay, so Prof, sorry, I want to ask you an ordinary question because I'm an ordinary person. So I go to the pharmacy. Do I go to the pharmacy and grab the hydrogen peroxide and gargle down?
Just give me a minute. I'll just finish with this, then I'll tell you this. So the idea is that if you gargle and there are any of the viruses attached to your epithelial cells in your upper respiratory tract, which have not established an infection or which have even established an infection are coming out to try to spread, that hydrogen peroxide will inactivate them and reduce the amount that are likely to spread further down into your lungs or further spread in your respiratory tract. Now, what we are recommending is that 0.5% of hydrogen peroxide is known to be able to disinfect if you use them on surfaces. So what we're recommending is that 3% is harsh. What we're recommending is for you to use just 1% to gargle. 1% meaning that if you take 1 part of the hydrogen, most of the bottles on the counters are 6%. So if you take 1 part of it, you add 5 parts of water. So let me make it simple. If you take 10 mils of hydrogen peroxide, you want to add 50 mils of lukewarm water, something you can gargle, to give you a 1%.
10 so and then add 50 mils.
Yes, so it's a 1 part in 1 part plus 5 parts. So it's a 1 part in 6 parts, which gives you a 1% from the 6% that you have. Most of the ones I've seen on the counter, I've not seen any other concentrations. I've seen 6% most of the time, Bell's and another one, but they are mostly 6%. So basically what we are trying to use, what we are encouraging people to use is as some sort of a prophylaxis. We're saying wear your mask, do all the things you're supposed to do. I use it when I get into meetings. I mean, Dr. Bediako, I heard him saying it. No matter how you try, there are some people around you who will not put on their mask. You try to avoid them. But sometimes you are in circumstances where all the best you can do is probably to keep your distance and not completely to avoid them. So in that case, when I think I've come into contact with people, a situation like that, then I gargle. Or we are recommending, therefore, that if you have people who have been infected living in the same house, they could then use it as a gargle to reduce the possible chances of the virus establishing infection in the upper respiratory tract infection. There are more uses that some others have put to it, but I don't want to bring it up here because I think it will probably create more
So just the final one on this. What happens if you swallow it? If you happen to swallow Oh, unfortunately, we can't hear you. Yeah, I think you have to. You have to unmute yourself, Prof. Hello, Prof. Okay, so I'm asking what happens if you swallow this substance. No, I think we have an issue there with Prof's audio.
Let me try and use my phone.
Okay, I can hear you now. I can hear you now, sir. I can hear you.
You can hear me now?
Yes, I can. Oh, so my question again, I asked, what if you were to swallow in the process, you swallow this substance, what's the danger?
It can give you an irritation in your stomach because of the nature of the thing. So the idea is that the reason why we are recommending that you should reduce the concentration to 1% is to be able to take care of the possible irritation. But you are supposed to gargle and pour out. And that's why we say that you don't recommend something like that for children below a certain age because they cannot gargle. My son is 10 years old and he's learned how to gargle. He knows how to gargle. I don't make them gargle all the time, but depending on circumstances and where we've been, I sometimes make them gargle and he manages to do it. So it's a matter of gargling and throwing out. It's a matter of not giving it to children. Some are proposing below even 12 years because they are likely to swallow it. But for people who can gargle, let them gargle. There's also a recommendation there that if the person cannot gargle for a reason, maybe age or having problems swallowing, what you can actually do is to put it on some sort of a cotton bud, and then you can then swab or clean the orifices so that the person then does not have to gargle and swallow. Okay. So it depends on the circumstances and who is gargling.
Okay.
But let me state this. We are not saying that this is replacing everything. We are saying that it's just an addition to what is being done. And then I also should mention that we should remember that vitamin C itself, in the process of metabolism in our host, actually produces hydrogen peroxide. So it is not strange to our body.
Okay.
But it is not for gargling. It is only for topical use. And that is it.
Okay, I'm curious.
It's not for swallowing, it's just for topical use.
Okay, Dr. Bediako, do you gargle too?
No, I don't. I gargle for dental health reasons. I don't gargle for COVID prevention. I guess I hear what Prof is saying, and I think all I would say from my perspective, not to get into a long drawn out debate, is that I think I'm happy to hear him say that this is not meant to replace any of the existing protocols. And I think if people choose to gargle, that is perfectly fine. I don't see any, provided they do it properly with the right concentration, I don't think they will come to any harm necessarily by gargling. But I guess, and I fully understand, I fully agree with the reason why dentists use it to minimize the amount that is shed in a particular amount of time. Where I would perhaps question is we don't yet have sufficient evidence that it has prophylactic benefits. For instance, I think in the write-up that Prof. Aite has shared, there's discussion about a family of people who did not transmit. That is not sufficient. We need a larger trial, and perhaps Prof might be able to say whether or not they are currently conducting a well-controlled clinical trial to really establish this. But at this point, we don't have a vaccine, and so we are calling, people need to protect themselves as best they can. As I said, gargling on its own, I don't think is harmful, provided you do it properly. So if people would like to do that, that is fine. I would say that I haven't yet seen convincing evidence that gargling has prophylactic benefit. I can see how it would temporarily reduce the amount that an individual will shed. So if we're using it in infected people, perhaps before a doctor goes to see someone in a treatment center, you ask them to gargle, I can see how that potentially would have some effect, some benefit for a short period of time. But in terms of protecting myself, if I'm in a room and somebody is not wearing a mask, I could gargle, but if the thing is already in me and has already entered the cell, provided, I'm not taking enough hydrogen peroxide to destroy the cell. So if the virus on the surface, maybe it will get rid of it. But once it's entered the cell, the virus is relatively protected, I believe, from the peroxide. Okay. So I think we are, at this point, it becomes a scientific debate, and we don't necessarily have to get into that.
Yeah, we will not even understand it.
I would say we need a clinical trial. Before I would say gargling is prophylactic, I would need to see a proper clinical trial with sufficient
controls to convince me. Okay. But yeah, that's where I fall on this. Okay, great. So, Prof, just the last bit on this issue, and for the purposes of better clarity, is this for prevention or this is for treatment? The recommendation
for prevention.
Okay, all right.
So and that's just to mention. I know that scientists disagree. Even amongst us, the medics, non-medics, scientists are disagreeing on it. But that's part of science. Science also agrees to disagree on some concepts. But yes, we are doing a clinical trial. We submitted a proposal to the Ghana Health Service Ethical Committee. We've almost finished with the revision, and we're sending it back. And we want to do an observational study on 2 groups of people, one group gargling, another group not gargling, and then follow them up for a minimum period of exceeding the likely incubation period to see how many people will become positive at that point in time. But the point we're trying to make is that I don't lose anything if I gargle. I mean, people are gargling other things. I know somebody who gargles a particular thing. I wouldn't mention it because I'm sure people will charge to the pharmacy and go and grab it as well. And this is observational. And he tells me that anytime he has a flu, he gargles this and he feels better. So I go and I check the contents of that particular thing. And I realize that, well, scientifically, it makes sense looking at the content of what he's been gargling. And that is actually can be used as a drink as well. So, yes, I mean,
yeah, but Prof, if we haven't done
that, we need to get, we are saying that from the observations we've made, this is what we feel. But he's made a point and we're going ahead with that. We're going to do a clinical, an observational study just to follow up people who are gargling and who are not gargling, look at the incidents, and then when we come up with the findings, we'll be able to convince probably people like Dr. Bediako.
Okay, well, I was just going to chip in and say that should we have perhaps waited for that clinical trial, to come out before publicly, making this known, seeing that people are already rushing to get it. And I wonder if they can actually do the diluted properly. But we have to end the conversation somehow. And I want to end
on I'll just do that. Yeah, so I'll just answer in the 30 seconds. People are inhaling neem tree in addition to everything that they're doing.
Yes.
People are inhaling all sorts of things and buying all sorts of chemicals, which, without proven, at least for hydrogen peroxide, our belief is that it has some proven effect on reducing viral load. So that distinction is what probably encourages us to encourage within our circles. We are not selling it out there, but within our circles. But we are still talking.
Okay, so it was a recommendation that you made. Have you received some sort of response?
Which one, please?
The use of the hydrogen peroxide to augment the COVID-19 treatment. Have you received any response from any state institution?
We are still talking to them. I've spoken with a number of people in the state institutions. They collected whatever information we had, and we are looking at it. So we would wait to hear from them first. Okay, great.
Just the last bit of this conversation, Dr. Bediako. Children are back in school. Should I still, and I asked Dr. Hackman, the medical doctor I spoke with just before you came on, and I asked for my personal purpose. This is personal. Should I still keep my children in school at this crucial time? Dr. Bediako, you have to mute? Yes. Okay.
Yeah, sorry, I was muted. That is a tough question, actually. I'm a parent myself, and it's something that I am grappling with. Children have been out of school for over a year. We cannot underestimate the impact that has on their education. So I fully understand the challenge the Ministry of Education, as indeed the government has, in trying to figure out when it's safe to send kids back to school. I think I would say it's a decision that has to be made on a sort of a personal level. It appears that children are less susceptible to the severe effects of COVID. That is not to say that some children have not had very severe disease. I think even in Ghana, there are a few children who have died. There are children who are permanently, paralyzed as a result of having, CNS engagement in COVID. So this is not to minimize what COVID can do to children, but in general, overall, children are appear to have less severe disease than adults. So I guess for me is if a school can guarantee that they would, if we can create classrooms that are not as crowded as typical, if there can be certain guidelines in place, and most of all, frequent testing. I am a big proponent of testing, and I've been saying over and over again, the best way to control this virus is to have sufficient testing so that people who are positive can be isolated from the rest of the people who are negative. So I think we need to think very carefully. I think our current strategy of only testing symptomatics is dangerous because children are less likely to be symptomatic. And the danger is the child may be fine, but they'll come home, hug a grandparent, hug an uncle or an aunt or a parent, and then that person may get very sick. And because children, especially younger children, it's going to be very difficult to get them not to play together and pass virus from one to another. Children may actually serve as a medium to enhance the amount of spreading that we see. So I think the idea to say, friends of mine have called me up, should I send my kid to school or not? I think, it's a difficult thing to say. I don't know. I don't want to say, oh, don't or do. But I think if we do send them, we have to think very carefully of how are we managing this? Do we have capacity in place to routinely, especially now that antigen testing has been approved by our FDA? I would recommend, if I was advising Ministry of Education or anyone, I would say, can we roll out a staggered antigen testing program in our schools? Antigen testing is much cheaper than PCR. It's what is being done at the airport. So, we are trusting it that it's relatively sensitive. If we could do that in schools or from time to time to hopefully capture children who may be asymptomatically, positive, then we potentially could see a future where, we are safeguarding the population, even though children are in school. But it's a very difficult one. I would say one thing to do, though, if your children are in school, when they come home, make them take a shower, make them wash down, protect those who may not be as resilient as the children, basically, in your home. So I think that is one thing to do. But I really do think as a country, we may need to think about, rolling out targeted antigen testing in our schools. We say we've only found 3 people who were infected, but we're only measuring symptomatic. I can guarantee you that if I go and test in a school right now, I will find more than 3 people who are positive. I'm willing, I'm sure even Prof will agree with me. Our seroprevalence studies, I go back to it, we found 20% people who had been infected in Accra alone. If we go into schools, we will most likely find people who are asymptomatic. So we need to think of a way where we can perhaps routinely just get a sense of the prevalence in schools. And I think the newly approved, FDA-approved antigen testing provides perhaps a more economical route to do this. Than PCR is probably not economically viable. But let's roll out an antigen testing scheme and let's get a sense of how many school children really have COVID-19. Okay.
Well, thank you, Dr. Bediako. Prof, I'll let you have a say on this as well, with the children back in school and the fact that we haven't seen schools suffer or record cases, but Dr. Bediako reminds us that only because we are not even testing in the first place.
So with the issue of children, I have children in school as well. So for me, in the absence of everything, you do the best you can. Sometimes those things may not have kind of a strong scientific basis, but it's a basic hygiene processes. So.
Oh, unfortunately, Prof's connection is frozen. Hopefully it defreezes, and so we can get that tiny little bit of tip before we wrap up this conversation. Still ahead, though, it's the second day. Today's the final day. The mortal remains of former President Jerry John Rawlings will be laid in state again today at the Accra International Conference Center. We'll go there after this conversation, but we're talking about COVID-19, the figures that we're recording. We've been talking about the new variant. We've talked about the hydrogen peroxide. I want my guests to leave us with some tips, even as some of us still take our children to school. Prof, if you're back and if we have a stable connection. Oh, okay, unfortunately. Oh. Okay, this hurts because Prof was just going to take us through the hygiene protocols for children when they return from school.